So, as we have mentioned in the previous classes, platelets are not whole cells, they are formed from megakaryocytes. Megakaryocytes are the precursors of the platelets, and platelets are not whole cells but cell fragments. So, as we have seen in case of RBCs and WBCs, platelets are from which lineage, myeloid or lymphoid? RBCs, platelets, granulocytes are all from myeloid lineage. Okay, we have seen this one again. This whole is myeloid lineage, only this part is lymphoid lineage. Common lymphoid progenitor, only the lymphocytes. Everything else is myeloid lineage. So, platelets are from the myeloid lineage. Thrombopoiesis, so platelet, just it is mentioned in your syllabus, formation of platelets, which is called thrombopoiesis. As formation of RBCs will be called erythropoiesis, or is called erythropoiesis, it is called thrombopoiesis. So, myeloid lineage from the blast cells or the precursor cells of the blast cells will be called megakaryoblast, then megakaryocytes, and megakaryocytes, single megakaryocyte will be cleaved into some thousands of platelets. From a single megakaryocyte, the different authors are saying, some are saying 2000 to 4000, some even up to 5000 platelets from a single megakaryocyte, and platelets are not whole cells. Pinches of cytoplasm are extruded from megakaryocytes to form these thousands of platelets, and platelets are not whole cells, cell fragments and anucleated. Like RBCs, they are not containing any nucleus. They have, RBCs also don't contain mitochondria, blood platelets contain mitochondria but no nucleus. So, thrombopoiesis, this is, as we discussed, hemocytoblast, blast cells, hemocytoblast, we discussed the different one or two types of theories which are not very important, there are different opinions on this. So, hemocytoblast, some are saying hemocytoblast is from the first the endothelial lining. So, like in erythropoiesis, which is the factor influencing erythropoiesis? Very important factor, erythropoietin secreted from the kidneys. In case of platelet formation, there is something called the thrombopoietin, and another important factor, associated factor, which is influencing the factor of platelets is interleukin 3. We talked of these factors, some factors, interleukins, in the formation of blood cells, which are influencing the passage of one stage to another. In case of platelets, thrombopoiesis is interleukin 3. So, these are, as I told you, that whatever these pictures are either from textbooks, some standard textbooks, or some pictures from the internet, but I'll ask you, don't search out pictures from the internet or your own, and don't follow those pictures. You follow standard textbooks, at least your textbooks, because some pictures in the internet are also giving wrong information. So, at which stage this thrombopoietin as well as IL-3 acts at the megakaryoblast? It acts on the megakaryoblast to form megakaryocytes. Some pictures on the internet are suggesting that they are acting at the hemocytoblast stage itself. That is wrong. Some or one or two. So, you don't go by random pictures from the internet. They are not all are giving right information. We have to go by standard textbooks. That is my point, because I found some pictures like this on the internet which are giving some wrong information. So, as students, you must go by textbooks, not internet pictures. Whatever pictures which are beneficial to you, that I am showing you over here just for the sake of explaining, understanding everything. Whatever textbook you read, you will get this information. So, thrombopoietin, interleukin 3, these are at the stage of megakaryoblast cells, not here, at the stage of megakaryoblast, not cells, these are cell precursors. Then see maturation and endomitosis. What is endomitosis? Mitosis, you all know, cell division. Endomitosis is something where only the nucleic acid material is replicating, but not the cell as a whole. So, what happens? The cell remains a single cell, but the nucleic acid goes on increasing, and these forms the megakaryocyte, multinucleated megakaryocyte, along with some pseudopodia. These evaginated structures called pseudopodia, and then these fragment down to form the ultimate cell fragments, which are the platelets. So, megakaryoblast, megakaryocyte and platelets, these megakaryocytes, when they are breaking down some structures called they are also called the proplatelets. From the proplatelets, then they become the platelets. You can see in this picture, this is just explaining or it just more vividly. So, this is endomitosis, the chromosomal material, the nucleic acid material is breaking down, then the pseudopodia formation, then the formation of proplatelets, these are separating from each other, and ultimately they will form the platelets. These are the release of platelets from these platelets, proplatelet fragments. Okay. And what are helping these sliding movements during formation of pseudopodia are all what are helping, already discussed in general physiology. Cytoskeleton is already discussed in general physiology. You have heard, should have heard about microtubules, microfilaments, etc. Microtubules are a very important component of the platelet structure. So, during the formation itself from megakaryocytes, microtubules have a role. Microtubules, the cytoskeletal structure contains microtubules, microfilaments, these things. These microtubules are very important, have a very important role in this connection. Okay. So, this is just in short about platelet formation, thrombopoiesis. Maybe you get a short note. These usually we have not encountered these as from the examination point of view, not as long questions. Just from this last session, I will not tell last session, in the last few months itself, even when your just immediate senior batch was admitted, the question pattern was a bit different. Now it has changed, just they have brought some modifications just 6 months ago. So, your senior batch faced their first phase university exam in the new pattern, that is 115 mark question. Earlier there were 215 marks. So, anyway long questions are usually we have not seen, we have seen from some long questions from hematology, but not from these topics. So, thrombopoiesis, as it is mentioned, if you go through your syllabus now, you should be acquainted with it. Just go to CBME 2024, find out platelets they are mentioning thrombopoiesis. This may be act as a short note, or obviously from all topics some MCQs may be set. Okay. So, again thrombopoietin and IL-3 interleukin 3 they act at this stage, and there is something endomitosis is related to, see MCQs may be formed anyway, MCQs, not all MCQs are very logical. Endomitosis, we have not found this term in RBC or WBC formation. This is in platelet formation. That means DNA, nucleic acid material is being replicated, but not the cell as a whole. So, structure of platelets, I just mentioned one statement, that is microtubule is very important to part of the structure of platelets, but like all cells, although these are cell fragments, this contains a cell membrane with whatever the cell membrane contains, phospholipids and all glycoproteins, these are also part of platelet structure. Okay, platelet structure, and there will be, it is anucleated, but there will be various, the cellular organelles will be there, and what is specific to the platelets, some granules are there in the platelets, namely two types of granules are mainly identified, alpha granules and dense granules, and these namings were on the basis of electron microscopic structures. So, alpha is the first letter of the Greek alphabet, as I told you in the very initial classes. In medical science you will, or in biology you will come across various these nomenclatures where these Greek and Latin terms, the derivations are from Greek and Latin. Alpha is the first letter of the Greek alphabet. Dense granules are actually in the electron microscopy, the whole of the granules they appear as very dark or dense, hence the names dense granules. But alpha granules comparatively lighter, the center is darker. These are all according to the electron microscopy structures. You cannot understand it in these pictures. These are diagrammatic representations. You cannot understand it, that means we cannot understand in these pictures. They are from the, these namings are from the electron microscopy. So without going into electron microscopy, we have to just memorize this. There is no option. But if you just remember where it came from, then it may be easier to remember. So these are based on alpha, these electron microscopy, but they are called alpha and dense granules, two types of granules. Okay, alpha granules mainly contain some precursors of some clotting factors like fibrinogen, factor 5. We will come to the discussion of blood coagulation after this, after studying about platelets. These alpha granules contain fibrinogen, that means precursors for these, some of the clotting factors. Fibrinogen is actually, this fibrinogen is formed in the liver, and they are in fibrinogen is in the circulation, they are endocytosed by the platelets. Exocytosis, endocytosis you should know, plus I think a bit of discussion has already happened in general physiology. After cytoskeleton transport, etc. is going on, these are very basic concepts in general physiology, I mean biology. In general physiology, they must have been discussed by now. So just exocytosis means releasing the contents outside, and endocytosis means engulfing the contents inside by a cell. So this is the fibrinogen is endocytosed, and these are contained in alpha granules. And one important factor which will come across during that means this chemical structure is not only this is derived from platelets, but this is named as platelet derived growth factor, which has some role in immunity. So platelet derived growth factors, or PDGF, you will come across at various junctures. This is platelet derived growth factor, where in platelets it is contained in the alpha granules. The dense granules contain some other materials like serotonin, something called serotonin. Okay, the adenosine materials like adenosine diphosphate, triphosphate, these are all contained in dense granules, and this is, the naming is according to electron microscopy. They also contain calcium. Calcium ions are also contained in dense granules. And this canalicular system, you will find it, this term mentioned in platelets. These are just this canalicular, this system is found elsewhere in the body also, but it is in the platelets, it is the membrane. In some areas it is found. This is called the open canalicular system in platelet membrane. So membrane, anucleated alpha granules, dense granules, and the various cellular organelles. And obviously, like most cell membranes, it will contain phospholipids. Platelets are small cells, or if not whole cells, cell fragments. They are even smaller than the RBCs. Although in your syllabus, in your MBBS syllabus till now, in Leishman staining, you are not required to identify platelets, okay, or you are not required, you are required to identify WBCs, count them, and do the differential leukocyte count. RBCs obviously can be identified, most numerous cells, but platelets are smaller cells, and on electron microscopy, this is just a structure of platelets in a more vivid way, detailed way. Membrane systems, this open canalicular system, and all organelles are there. So in under the Leishman staining, you are not required to identify SIM, but see, platelets are found, these are smaller cells than RBCs. Okay. So these purplish bluish structures, so these are platelets, smaller cells. Platelet size is, what is the diameter of RBCs? 7.5 micrometer, no, it is not always exactly size, 7.2 to 7.5, it will be a range, but platelets are even small, even as small as 2.5 micrometer, as maximum 5 micrometer, like this. These are the size of platelets. This is just diagrammatic representation. So this is, if you find another, most cells, what are the most numerous cells? These are the RBCs, surrounding RBCs, platelets are smaller. I think this is somewhat disproportionate, not so small. They are showing the RBC so large, but the platelets so small. These are the others, WBCs, eosinophil lymphocyte, as they are found. We have discussed the structures you have seen under the microscope. Platelets look like this, but in your syllabus, for the, at least for the practical part, you are not required to identify them. Okay, so but these look like this under the in Leishman staining, or there are other stains also. Platelets look like this. So this is in short about the platelet structure. So functions of platelets, I think not very difficult. Functions of platelets, the main function is hemostasis. Now I'll just mention here that just note this term. So many of the students are from vernacular media, so understand the terms, don't make some during short notes what is happening, very common mistakes. So hemostasis and homeostasis are totally different things. So nobody, I think, are expected to explain to you, but these mistakes are found. So here stasis is meaning stoppage. Homeostasis is different thing. We have studied in general physiology. Homeostasis is balance. Homeostasis talks of balance, and whenever it is hemostasis, hemo is related to blood, stasis is related to stoppage. So stoppage of bleeding is what is the role of platelets. So if you get it as a short note, so first read carefully whether it is homeostasis or hemostasis, and then write it out. Otherwise you are answering something, even if you know the topic, maybe you know the topic, but you are answering something what is not required, and you are getting no credit for that. So just remember these two terms, these are completely different terms. This one or two letters rearrangement makes it a completely different terms. Hemostasis is the primary function of platelets. So platelets, what they do, if we call it very simply, just in layman's term, they will say they accumulate at the site of bleeding and forms a temporary hemostatic plaque. This is in layman's term, but actually what happens, we'll just be seeing what happens. So formation of temporary hemostatic plug. And this is followed by the definitive hemostatic plug, in which platelets have a role. But what is this definitive hemostatic plug? Which is actually blood coagulation or blood clotting, which involves all the clotting factors and the activated forms of the clotting factors. The platelets, the role of the platelets is formation is temporary hemostatic plug, and platelets have a role in the leading to the definitive hemostatic plug, but it will involve the clotting factors. But temporary hemostatic plug is more or less the functions of the platelets, not alone, but most important in temporary hemostatic plug is the platelets. Okay, this is the, and except forming the hemostatic plug, platelets are other functions like are after the formation of clot involving the clotting factors, these help in clot retraction. Okay, clot retraction. There are, in the structure of platelets, we mentioned about the cellular organelles and all other things, granules. There are actin, myosin, proteins also, and previously there was actin, myosin together called, if you get this term anywhere, remember the actin, myosin present in platelets, later they were identified that this is similar to the actin and myosin present in muscle tissue. We will discuss, muscle physiology will be discussed. You must have heard in muscle tissue there is actin and myosin. So previously it was called thrombosthenin. So if you get this term, understand this is talking about this term is no longer, that means no longer much valid, but if you get this term anywhere, even if you face in the exam in MCQs, remember they are talking about the actin myosin in platelets. So these contractile proteins help in, which is, we should no longer call it this term is become obsolete, but this is still mentioned that because it has been found why it has become obsolete, that it is similar to actin myosin present in muscles. Those actin myosin or thrombosthenin as it was previously called is helping in clot retraction. Like in case of muscle physiology, in muscle physiology you will see actin myosin is helping in contraction, here they are helping in clot retraction. So after the main role of platelets is formation of temporary hemostatic plaque, but after definitive hemostatic plaque clot has formed, clot retraction, this platelet thrombosthenin, or we should call it platelet actin myosin, helps in clot retraction. Clot or clot dissolving, dissolves blood clots, okay. And then they have other roles like chemotactic function. Chemotactic function we mentioned the other day in basophils, like they secrete, do you remember chemotactic function in basophils? What is the chemotactic function in basophils? They attract eosinophils to the site of allergic reactions. Eosinophils are both have role in allergic reactions, and basophils what they are doing, they have something called the ECF. So you should be, if you, this was just discussed last week, you should not forget. So chemotactic function like in basophils, like in case of platelets, the chemotactic function means attracting something to another site. What do platelets attract? They attract neutrophils and monocytes to the site of inflammation. Okay. Neutrophils and monocytes, their role is phagocytosis. So platelets are indirectly helping in phagocytosis. They are attracting, they have a function in, this is called the chemotactic function of platelets. So primary function is temporary hemostatic plaque. After the formation of clot, it helps in clot retraction. They secrete chemicals and they draw the neutrophils and monocytes to the, for their ultimate phagocytic action, to the areas of inflammation for their ultimate phagocytic action. And platelets have the capability, at least some capability, to themselves phagocytose some particles. They usually don't phagocytose bacteria, these that are the functions of neutrophils and monocytes, primarily neutrophils, and monocytes help them, but some virus, some carbon particles and all these are the platelets have the capability to phagocytose these materials, and platelets contain these serotonin and all these materials. Wherever required, serotonin is a potent vasoconstrictor. What is the meaning of the term vasoconstrictor? Vasoconstrictor. Vaso is related to blood vessels. So constriction, narrowing of blood vessels. Serotonin is a potent vasoconstriction. Again, whenever this during the formation of temporary hemostatic plug, platelets secrete serotonin, and serotonin itself constricts the blood vessels so that bleeding is stopped. Okay. So in case of injury, platelets will not only themselves from the hemostatic, from the temporary hemostatic plug, but platelets being activated themselves, they secrete serotonin, which is a potent vasoconstrictor, and potent means very able vasoconstrictor. That means it has a high capability of, so by constricting the blood vessels, obviously in case of very large wear and tear, if the say arteries are tore off, then obviously this formation of hemostatic plugs won't help. But in case of smaller injuries, as we face in everyday life, this temporary hemostatic plug and vasoconstriction by serotonin is important, just important for stoppage of bleeding. Like in the practical classes, we are taking capillary blood, so that minute bleeding, formation of hemostatic plugs and vasoconstrictions, these are leading to again stoppage of bleeding. That is what is the role of the platelets. So again, primary role temporary hemostatic plug, and there are other roles which we mentioned of. And during the formation of this temporary hemostatic plug, we talk of 3 stages. Platelet, firstly, whenever there is injury to the blood vessel, platelets are adhering to each other. Platelets are in circulation, they adhere to each other and to the endothelial surface. That is called adhesion, and this is, there are detailed mechanisms for it, which you don't require much detailed mechanisms for it, but platelets adhere to the surface, to their own, the platelets adhere to each other and also to the surface of the endothelial cells. There is a circulating factor called the VWF. This is again after the name of a scientist, von Willebrand factor. Von Willebrand factor, they are attracting this, they attach to the endothelial surface by this means of this von Willebrand factor. There are receptors, as in case of all cellular receptors, not all, sorry, as in case of cellular receptors, platelet membranes also contain receptors, mostly the which are helping in this formation of hemostatic plug. These receptors are chemically glycoproteins. That means protein moieties. Glycoproteins means protein moieties attached to what? Carbohydrates, glycoproteins. So we will mention the names of some glycoproteins in some platelet membranes. For the von attaching of the von Willebrand factor to the glycoprotein membrane, platelets contain something called the, just see, these are some glycoproteins initiated by GP, by the prefix GP. So glycoprotein, these receptors on platelets are named by GP. Mostly they are glycoproteins which are forming in the formation of this hemostatic plug, and GP, see, in case of this attachment of VWF or von Willebrand factor, this glycoprotein is 1B59. So don't get confused with such names. These names, origins of names are from, these are from many years. These names of GP is for glycoprotein, and according to the Roman, as they were identified one after another, they were named by these Roman numericals. Here Greek numbers were not used or Greek alphabets were not used. They named it Roman numericals, and then various subtypes were discovered. They were discovered as such, and these few names we just have to memorize. There is nothing to do. GP, this attachment of VWF von Willebrand factor is mainly by GP 1B by 5 by 9. So these are subunits of glycoproteins, and these 3 subunits together help in the attachment or this adhesion via to the subendothelial or the endothelial, where the blood vessel is cut to the the endothelium is injured, to the subendothelium platelets are adhering by means of the von Willebrand factors, and this von Willebrand factor is attaching to the platelets by means of this glycoprotein, which subtype is this. Some glycoproteins names which have to, not all, but some we have to memorize. For VWF it is GP 1B59. These various numbers mean that various units and subunits, they are forming one unit and helping to attach this particular factor. So platelets, as we called, they also attach by to the endothelial surface by fibrinogen. Fibrinogen, again, what is we mentioned, formed in the liver endocytes by platelets. Those are 5GP2B3A, and this is the most common glycoprotein mentioned along with when we talk of platelets, GP2B by 3A. Again, they were named historically. These names have been derived as they were discovered. They have subunits. This 2B3A subunit is the most mentioned one among the platelets. They are attaching to the subendothelial surface. helping by fibrinogen, say surface receptors GP2B3A and fibrinogen attaching to the subendothelium by means of that. Collagen, fibronectin, fibrolaminin are other factors by means of which they attach or adhere to the subendothelium. All these are found in the endothelial lining. So VWF, fibrinogen, these are attachment of the platelet to the endothelial lining, which is also called adhesion. So adhering to themselves and to the endothelial lining. This stage is called platelet adhesion, the first step in the formation of temporary hemostatic plug. So there they are mentioning it is tethering, that is transient adhesion, then stable adhesion. First factor which involved is VWF, then the others come fibrinogen, collagen, fibronectin, laminin, all these things, and the glycoproteins are different in the different, in case of these different factors. In case of VWF it is GP1B by 5/9. In case of fibrinogen it is 2B3A. In case of collagen it is GP6, and there are other glycoproteins involved also. Not all are needed, but some we should be remembering, because these are days of MCQs. GP2B3A will be mostly be mentioned. You will see there that they are mentioned. After adhesion, what happens? Platelets undergo something called, which is called platelet activation. This is nothing, we are calling it is activation. They release some materials, these which is the granular contents, and they form some structures called the evaginated structures from the membrane. Like pseudopodia, they form evaginated structures from the membrane, release their contents, granular contents, calcium, ADP, okay, all these contents they are releasing. ADP is helping in the formation of this something called thromboxane, A2, which is helping in this formation of temporary hemostatic plug, TXA2 from ADP. So ADP is contained again in which types of granules? Dense granules. Alpha granules will contain the, just remember alpha granules, whatever clotting factors, when you read the names of the clotting factors, I think you may be knowing, but read the names of the clotting factors. Alpha granules will contain some of the inactivated forms of the clotting factors and PDGF. Just remember it simply. If you try to remember it like this, dense granules contain this and this, as it is written in books, alpha granules contains this and this. So there is so much to memorize in medical science that it will be just it becomes difficult. So try to remember it simply. It will help you to tackle MCQs as well. Alpha granules contain inactivated forms of not all but some clotting factors, like factor 5, prothrombin, and it contains this fibrinogen, which is endocytose. So these are clotting factors. So when you know the names of the clotting factors, any clotting factor you get, if it is associated with platelets, it will be contained in alpha granules and PDGF. Rest whatever you get, you associate with dense granules, serotonin, calcium, adenosine nucleotides, mainly ADP is important here. ADP, ATP also is contained, ADP. All these things you associate with dense granules, then it will be easier to remember. So clotting factors, protein factors, clotting factors and PDGF, alpha granules, rest with dense granules. So this is activation, release, formation of this called type of pseudopodia, lamellipodium, plural is replacing the UM by A is plural, formation of lamellipodia, pseudophilopodia, and release of the contents, this is platelet activation. And after platelets are activated, this release of thromboxane A2 and all, this help in recruiting more platelets to the site, and ultimately they come in contact with each other to form the temporary hemostatic blood, what is called platelet aggregation. So, three classically steps are described: adhesion. These events are going on one after another, and more platelets are activated. This is like a, this is not a feedback system actually. You have read about positive and negative feedback, but this is like a feedback, positive feedback, that is more, the process is going on and more platelets are recruited, more platelets adhere, more platelets are activated, more platelets are, and they aggregate, this aggregation is happening so that the temporary hemostatic plug is formed, and as thromboxane A2 is released, it is itself, this thromboxane A2 has role in, so that more platelets are adhered and activated. So, adhesion, flowing blood, injury to blood vessels, adhesion, activation, aggregation, and as it is going on, still the bleeding is stopped. This is going on in a synchronized manner. This is not actually a feedback system, but we may compare it with a positive feedback system. Okay. So, this is how the temporary hemostatic plug is formed, which is the main role of platelets for the arrest of bleeding. So, platelet, this counts, as you know, this is, what is the platelet count, accepted theoretical value for platelet counts? 1.5 to 4 lakh, most standard texts are mentioning 1.5 to 4 lakh. So, some physiological variations. So, in children platelets are lesser, yet that as after the birth the levels increase. It is seen that adults, the adult platelet levels are reached by the 3rd month after birth. There is no difference in males and females, but during menstruation platelet counts are decreasing, not because there is blood loss. In menstruation maximum, there is maximum means even if there is heavy menstrual flow, how much blood will be lost in 3, 4, 5 days? Maybe 80 ml, 100 ml. So, that does not decrease the platelet count itself. Blood platelets, any bleeding process, the endometrium of the uterus is shaded off. Platelets have a role in this. More and more platelets are being recruited for this. Anywhere bleeding is occurring, platelets are getting recruited. That is the reason for somewhat decrease in platelet counts during menstruation, but not the blood loss itself. Platelets are formed at a certain rate. So, platelet itself, just 80 ml blood loss in 5 days will not lead to platelet count decrease. So, menstruation does not lead to decrease in RBC counts. It does not lead to decrease in platelet counts, but platelets are recruited during any type of bleeding in the body. So, that is why platelet counts decrease to some extent, but it recovers physiologically. It recovers by itself in high altitude and after meals due to various factors, stress factors and all. Platelets are like we talked of the platelet adhesion to the endothelial surface via von Willebrand, all these happens under stress. So, in high altitude after meals, this is called, anything after meals is called, you will get this term in various discussions, postprandial. Postprandial means after meals. So, postprandial, increase in platelet counts, increase in platelets counts due to high altitude in females during menstruation, and somewhat less platelet counts in the first 2 months at birth, and in the first 2-3 months after birth it is somewhat less. So, these are just physiological variations, nothing to worry about physiological variations. So, these are taken care of by the body by itself, but in some cases there may, in some cases in diseases there are actual increase or decrease in platelet count. So, one is this primary or essential wherever, like I told this term postprandial. So you will get it not only, this is not only for platelet, postprandial means after meals. So postprandial blood glucose, we measure postprandial blood glucose 2 hours after meals in diabetic individuals. So we take a reading for fasting blood glucose and postprandial, that is the meaning of the term postprandial blood glucose. So platelet meals, after meals rise in platelets may be called postprandial, or should be called postprandial increase in blood, in platelet counts. Increase in platelet counts is called actually thrombocytosis is the term for increase in platelet counts. Like, what is the term for the increase in leukocytes? WBC is leukocytosis. For agranulocytes it is monocytosis, lymphocytosis. However, in case of granulocytes it will be called neutrophilia, eosinophilia or basophilia. But wherever we cytosis is increase in counts, thrombocytosis, leukocytosis, monocytosis is for monocytes, lymphocytosis, erythrocytosis is for erythrocytes, thrombocytosis. So again, primary thrombocytosis or essential. Again, sometimes you will find the terms primary or essential interchange. Primary means essential, and in many cases causes are not known but they happen, like essential thrombocythemia or thrombocythemia. These are just variations, just terms varied according to the English language. Cythemia, cytosis. Cythemia is mainly mostly not used, cytosis is used. So essential thrombocythemia, polycythemia, myelodysplastic syndrome, myelofibrosis. Just note these terms for now, not you just know one or two terms. These are names for various diseases, various cancerous manifestations. So these may lead to increase in platelet counts, among them myelofibrosis, and these myelodysplastic syndromes are something which mostly lead to, actually they are suppressing the bone marrow, mostly lead to actually decrease in platelets, but sometimes associated in the initial stages with increase in platelets also. On the right hand side, these causes are given. You don't remember all causes. Platelets are destroyed in the spleen. So after, if there is splenectomy means removal of the spleen, or somehow overactive spleen, if spleen is functioning more than required, then it may lead to if spleen is not functioning properly, it may lead to thrombocytosis. So one term just you remember, this one is primary or primary thrombocytosis. Many times causes are not known. Essential thrombocytosis due to some diseases like this polycythemia vera, myelodysplastic syndrome, myelofibrosis, chronic myeloid leukemia. Among them, one or two causes are there. Platelets decrease, mostly in most cases platelet decrease, but sometimes they may increase. Primary, and another term is reactive. If you get, say, I think you won't get, you may get in physiology, you may get in medicine when you study medicine, but not in physiology. But still, if you find a short note or you have to write one or two lines about this, primary and reactive. Reactive means after acute blood loss, after acute infection, sometimes in iron deficiency anemia, okay, decrease in RBC counts, even when the bone marrow is non-specifically, it is bone marrow is by feedback mechanisms, bone marrow is becoming active. So that time platelets may increase. Iron deficiency, hemolytic anemia in some cancers, and due to some drug reactions in some chronic diseases, platelet counts increase. So in cancerous, in these conditions, it is primary thrombocytosis, and in some cases due to other causes in the body, like after acute blood loss, in iron deficiency anemia, even in response to exercise, response to thrombocytopenia means thrombocytopenia is decrease in platelet count. So just rebound increase in platelet counts, this is thrombocytosis, some causes of thrombocytosis. I don't think it should be asked or will be asked in physiology exams, but if just you have to write 1 or 2 lines, just write like this: primary and reactive. And thrombocytopenia, that means thrombocytopenia, like in case of decrease in WBC counts, it will be called leukopenia, neutropenia, eosinophilia. Decrease in platelet counts is called thrombocytopenia. These have again various causes, like see they have mentioned like a mnemonic. So to remember the causes, see the first letters are forming platelets. So just remember there are some disorders where thrombocytopenia itself, like in case of bone marrow suppression, why they are mentioning like this leukemia, anemia, just the reasoning behind it is in case of bone marrow suppression, due to any cause, if bone marrow suppression in there, all cells will decrease, all blood cells will decrease, and along with that platelets will also decrease. So platelet, there are some platelet disorders in alcohol, in alcohol intake, if in too much of alcohol addiction, so there is some like toxicity, platelets decrease. There are other toxins like benzene and all. Sepsis means this infection, very traumatizing or very severe infections leading to sepsis, they decrease. All these things decrease to decrease in platelet counts. In viral infections, mainly one very hazardous viral infection in which platelet counts decrease to a large extent is dengue, which is prevalent much in this West Bengal in the last 12-15 years. This dengue fever is in every year 2-3 months, it is just now literally named as the dengue season. In dengue fever, in all viral infections platelet counts decrease, but dengue fever is one in which the platelet counts decrease to a great extent, and we have to monitor. That means as medical professionals, we must know that dengue fever platelet monitoring is very important. There is nothing to do if platelet counts decrease, say less than 60,000, 50,000, then the subject individual must be, the patient must be hospitalized, and platelet transfusion may be required. In Western countries, what they are doing, so even we may wait even up to still lesser, up to 20,000, 30,000 blood platelet counts must be done if required even 4 hourly. Okay. But in these developing countries, sometimes we don't, there is no option to do it 4 hourly, 6 hourly, so do it 12 hourly, 24 hourly, and even if it comes around 50,000, 60,000, sometimes we think of platelet transfusion. Otherwise, there is no other way to increase platelets very rapidly like that. So platelet transfusion will be required from outside. Just know one term associated with decrease in platelet counts, that is purpura. You will read about purpura in medicine. Purpura, there are definitions, but just for now you may remember purpura as purple spots on the skin. These are due to bleeding manifestations on the skin. Purpura, remember, just for now remember is purple spots on the skin, bleeding manifestations. So, this is already given, this like image, bleeding manifestations, these may be numerous if they are more in number, in these spots are huge in size. This is called something called ecchymosis. All these things you will study in medicine, but just for remember, these spots, bleeding spots on, is called purpura. This is a bleeding disorder, either due to platelets are adequate, maybe platelets are decreased in number, or platelets are adequate in number, but they are not functioning properly due to some reason. Purpura, this is called thrombocytopenic purpura due to platelet disorders. Purpura may be caused due to endothelial damage, endothelial disorders as well, but due to decrease in platelet counts in purpura occur, then this is called thrombocytic purpura. Two types are mainly recognized, immune thrombocytic purpura and thrombotic thrombocytic purpura. Don't need the details of it now. Immune means there are some, due to some immune autoimmune causes, destruction of platelets, this purpura is occurring, and if it is thrombotic thrombocytopenia due to various the pathophysiology, detailed pathophysiology we don't need right now at this level. So, two types are recognized, immune thrombocytic cytopenic purpura, thrombotic thrombocytopenic purpura. Purpura may not be only these manifestations, spots on the skin may not be only due to platelet disorders, it may be due to endothelial disorders, other causes, but due to platelet, if they occur, platelet decrease in platelets, these are called thrombocytopenic purpura. Okay, so these are whatever is mentioned in short about platelets, thrombopoiesis, how platelets are formed, brief structure, functions, not only formation of hemostatic blood, but some other functions, and variations in platelet counts. Thrombocytosis is increased, thrombocytopenia is decreased, and there are some causes of physiological variations. So, after this we will pass on to blood coagulation, how blood clot is occurring. Okay. So, we have discussed formation of blood cells, composition and functions of blood, formation of blood cells, about plasma proteins, RBCs, WBCs, platelets. We will pass on to blood coagulation. What is left is along with RBCs, what is just see your syllabus, hemoglobin. We will discuss hemoglobin after that. Okay. So, in practical sessions, these from today onwards, we have already discussed just you already know, but just the blood groups we discussed in the last class, just the basis of blood groups. In the practical sessions this week, we will be doing blood grouping. So, 3 groups, today is group A. For the practical sessions, we will be doing blood grouping in the practical sessions today onwards.